This is John Geaver for MedPage Today. Studies have suggested that high doses of vitamin E can prevent onset of dementia in older patients. But its effectiveness as a treatment for patients diagnosed with Alzheimer's disease is less clear. A further complication is that in 2004, meta-analyses suggested that high doses of vitamin E in the range of 2,000 IU per day may actually increase mortality. An Alzheimer's clinic at Baylor College of Medicine in Houston has been encouraging patients to take high-dose vitamin E supplements since 1990. Dr. Valory Pavlik, an epidemiologist at Baylor, reported on the clinic's experience with vitamin E.
Until 2004, clinicians at the Baylor Alzheimer's Disease and Memory Disorders Center recommended this dose, the 2,000 total international units per day, as part of standard treatment. After 2004, the recommendation continued for vitamin E as an adjunct to their anti-dementia treatment, but they were given an information sheet indicating the controversies surrounding vitamin E as a result of these meta-analyses. So we carried out this study to determine if patients who had taken the recommended dose of vitamin E had a shorter survival time. That is, were we affecting the overall survival of the patient population with this treatment recommendation.
Dr. Pavlik's group studied outcomes of 847 patients treated from 1990 to 2004 at the Baylor Clinic. Most of the patients took vitamin E, but some took no drugs, and others took only cholinesterase inhibitors, the approved drugs for Alzheimer's disease. Dr. Pavlik first reported the difference in mortality for all patients taking vitamin E versus those not taking it.
There was a 26% lower risk of dying in any given interval. The hazard ratio was 0.74, and the p-value was 0.009 for this comparison. Now, some patients taking vitamin E were also taking other anti-dementia drugs, mostly anti-cholinesterase inhibitors. So in order to determine whether it was really the other drugs that were driving this main result, we made two additional comparisons. So among those taking vitamin E with or without another drug, compared to no drug, the mortality rate was 23% lower over time. And this comparison was marginally significant. The p-value was 0.051. Those taking a cholinesterase inhibitor alone, compared to no drug, had a slightly higher than average mortality rate.
That higher rate was not significant, but it suggested that the cholinesterase inhibitors were not responsible for the benefits seen in patients taking them as well as vitamin E. There weren't enough patients taking only vitamin E to allow a direct comparison, Dr. Pavlik explained.
Patients whose regimens included vitamin E tended to survive longer than those taking no drug or cholinesterase inhibitor alone. So we think that this study first is reassuring in that rather than causing harm, treatment with vitamin E appears to be protective when you measure outcomes in terms of overall survival. And also, it suggests that additional research on the use of vitamin E in treatment of AD is warranted.
I'm John Geaver, MedPage Today.